Welcome to Lifestyle with Neeraj. The status of modern medicine in the management of osteoarthritis leaves a lot to be desired. We can put man on the moon, but we cannot change the course of an everyday universal affliction such as osteoarthritis. As you may know, osteoarthritis affects 1 in 10 Canadians. Indeed, it is very common. Many individuals will confuse this condition with osteoporosis due to the similarity in the words. They both contain the prefix osteo, which originates from the Sanskrit word osteo, meaning bone. Osteoporosis is the disease that results from loss of bone structure and mass. Think of it as thinning of the bones. Osteoporosis is completely silent, in other words, asymptomatic, until a catastrophic event occurs such as fracture at the spine or hip. In individuals who habitually stand with rounded shoulders and a bent or kyphotic spine, the deeper portions of the vertebra collapse or compress, resulting in the so-called Dowger's hump. These compression fractures are a sign of osteoporosis. Osteoarthritis is not related to this condition. Osteoarthritis results from erosion of the smooth cartilage found on joints. This progresses until bone is resting on bone. Obviously, most individuals suffer from progressive pain at the affected joint, especially when they try to use the joint or are weight-bearing. This process can result from a genetic predisposition, excessive wear and tear, or injury. A useful clue is that if the non-weight-bearing joints such as fingers and thumbs are affected, then you had a genetic predisposition. On the other hand, if only the hip or knee is affected and you have risk factors such as obesity or sedentary lifestyle, then it is likely acquired. We have come to recognize that osteoarthritis can come in many forms or phenotypes. In many cases, there is no obvious inflammation at the joint. In others, there are indeed signs of inflammation, which means that the joint exhibits swelling, acute pain, warmth, and redness. Certainly, in advanced cases, the affected joints will exhibit clear signs of inflammation. After evaluation by the family doctor, the treatment of this condition initially consists of pain-controlling medications or analgesics such as acetaminophen. Many individuals will report that this drug does not provide sufficient pain control. The physician may choose to upgrade the treatment to include anti-inflammatory medications which have been found to provide superior pain control. Examples of these medications include naproxen, diclofenac, ASA, and ibuprofen. Sometimes patients will start to take opioids to control the pain. These are medications which are related to morphine. This is no longer approved in Canada due to the potential for dependence. However, the anti-inflammatory medications have their own issues. Chronic use of this class of medications can cause bleeding ulcers in the stomach, deterioration of kidney function, and elevation of blood pressure. Diclofenac has the additional problem of liver toxicity. Obviously, osteoarthritis is a chronic condition and accordingly, its management requires a long-term regimen. Patients suffer until their disability becomes so severe that the joint has to be surgically replaced. This is the best we can do to change the course of this common condition. After the patient has suffered for many years, the family doctor may decide that it is time to refer to an orthopedist. Unfortunately, it takes 2 to 4 years from the time the referral is made to obtain a joint replacement in Nova Scotia. Where else can one look to find help in this all too common condition? I have examined the approach used in traditional medicine in ancient civilizations. After all, this condition was well known to ancient people, even though lifespan was considerably shorter. For example, I came across a study published October 2017 on the use of Benjacul, spelled as Benjakul, in the treatment of osteoarthritis of the knee. This was a double-blind, randomized control trial. Benjacul is composed of extracts from 5 plants and is used in Thai traditional medicine. The results showed a trend towards reduction in pain and stiffness, which were somewhat inferior to diclofenac. I note that there was no placebo used in the study group. The authors did not find any evidence of kidney or liver toxicity, although the study period was quite short, 28 days. However, there were changes in liver and kidney function with the use of diclofenac over this time period. One of the extracts in Benjacul is ginger. Scientific research has found that compounds derived from ginger can inhibit the enzyme cyclooxygenase 2, which is involved in inflammation. This leads me to another point. I do not believe that extracts from natural sources such as plants are always safer than pharmaceutical medications. Each product must be tested and certified for purity, dosage, standardization, and safety in addition to efficacy. Sometimes these so-called natural products can have significant interaction with other medications that one may be taking, potentially resulting in serious side effects. An extra level of safety probably exists in the foods that we consume. In this case, ginger can be made part of the diet easily, for example in cooking or as a flavoring for tea. Other foods with anti-inflammatory properties such as curcumin found in turmeric and omega-3 fats found in oily fish can also easily become part of the diet. Finally, just as we know that regular exercise diminishes the pain of fibromyalgia, medical research has also shown that remaining physically fit helps the pain associated with osteoarthritis. Thank you for watching. I hope you found this video informative.